when I see a lot of posts of my friends really talking about it, and I've seen so many things. I don't know whether really to accept them. Someone said we should stop buying pure water and bread, and I'm like, what the hell? So today I've taken the initiative to invite Damilola Graham Douglas, who is a public health consultant, and she's going to just tell us how scared we should be or how scared we should not be, how prepared Nigeria is to fight this, because I know Nigeria really fought Ebola I think 4 years ago, so I think we will be safe. And then what are the myths and what do we need to protect ourselves with? So Damilola, welcome to my show.
Thank you for having me.
Yes, so I mean, should we be scared or not?
Well, I don't think we should be scared. I just think it's more about being aware and protecting yourself.
Okay.
Obviously, there's this outbreak out, and obviously, we all know how rapidly it's spreading across the world. But we know that there's ways to protect yourself. So, in terms of fear, I think that should be ruled out.
Okay, so I'm hearing this news that the coronavirus is only in 3 African countries, Egypt, Algeria, and Nigeria, and there's this news going around that it's black people are resistant to that. Is it true? That's why it's not spreading fast in Africa or in sub-Saharan Africa, or it's just a coincidence?
From what I know, I don't think any scientists have done any research to prove that black people are susceptible to the infection or hot temperatures kill the virus, and there's been a lot of stories about hot temperatures killing the virus. No, that has not been proven yet. But yeah, like you correctly said, there are 3 African countries that have been affected so far.
And are we really prepared as a country?
I think Nigeria, I would say we do have the resources.
Good.
In terms of being prepared, but it's about acting quickly.
Okay.
And you know how it is when once resources are available, how quickly can the resources be pushed out? So that's the problem. And yeah, in terms of human workforce, I think we have the human capacity to be able to fight the disease.
I mean, in Africa, we're always talking about our African brothers, so I'm not sure how prepared other African countries are. I think I heard 2 weeks ago, ministers of health from different African countries gathered at a point to discuss how prepared they are. I don't know what you think about that as well.
Yes, there's been a lot of gatherings since the outbreak happened since December 2019. So even besides African countries, other countries, because it's not only African countries are even like the least in terms of number of cases. So health ministers have been gathering from countries that have been affected. Donor partners have also been gathering. So there's a lot of ongoing discussions as to how the disease can be, how the outbreak can be controlled and what steps need to be taken. I know there's even vaccine, there's even ongoing activities to develop a vaccine in China. So yeah, there's been a lot of meetings and gatherings.
Okay, that's great. So I had more than 89,000 cases of this virus now in more than 58 countries. But then I also learned about 45,000 are cured. So that means people could get cured of this disease.
Yes, so people, well, I don't want to use the word cured, more like recovery.
Recovery, okay.
Yeah, so you recover from the disease. Yes, there's no actual treatment for it. So the coronavirus basically is sort of the same virus that causes a common cold. Yeah, or the same virus that caused SARS, for example. I don't know if you're aware of the SARS outbreak that happened a few years ago.
Yeah.
So yes, you can recover if you take the right treatment. So yeah, there's been cases. So a lot of times, most people actually die due to other comorbidities that they're experiencing, not necessarily as a result of the infection of the virus. So, and it's usually among the elderly, so they probably die of other causes like kidney failure. Yeah.
Well, that's really good news. So, I mean, going forward, what do we need to do to protect ourselves? So, how stuff flies over social media. I remember during the Ebola crisis, people were saying people should take their bath with salt water. Now people are saying you should not buy bread, you should not buy tomatoes from public places, you should not buy pure water sachet, all that. But what do we need to do to protect ourselves?
I think for me, regardless of corona, I think generally everyone should have good, effective measures in protecting themselves. So obviously there's been a lot of talk about, good hand sanitation.
Yeah, so this is a hand sanitizer. This will work.
Yeah, but this is not enough. You need to wash your hand with soap and water.
So soap is better than hand sanitizer?
Yes, and then you can go over with hand sanitizer.
But then you were telling me something about this.
Yes, so most hand sanitizers are antibacterial.
Okay.
Meaning they are obviously more effective to bacteria. And corona is a virus.
Yeah.
So it's recommended that you do wash your hand with soap and water, because that would more than likely kill any be it virus or bacteria, whatever microorganism.
Well, then that solves the problem, because people are complaining there is no hand sanitizer in the supermarkets. So we should just buy soap and put in our purses and bags and go around with it, right?
Yeah, so the whole point of hand sanitizers is obviously it's handy. You can easily just put it in your pocket or in your handbag, but realistically, it's not everywhere you go to that you have access to clean water.
Right.
Yeah, we have to actually emphasize on that. So it's not just washing your hand with soap and water. It has to be clean water. Yes. So this is kind of like an addition to after you've washed your hand with clean water and soap.
Okay. And then what about this? I saw some people really wearing this. What do you think about that?
Yes, face mask. Yes. So the thing with coronavirus is we've been able to see that the transmission is through air droplets. So it's not airborne. It's air droplets, meaning, for example, if someone is affected and they cough or sneeze, and you're in close proximity with the person, the droplets can be transmitted. Or for example, if they cough and sneeze on the surface and you touch the surface and then you touch either your eyes or your nose or your mouth, then you get infected. So the whole idea of wearing a face mask, for some people it could be a misconception, because some people will see someone wearing a face mask and automatically assume that, especially now that there's this whole coronavirus all around, they would automatically assume that you have coronavirus.
No way.
But you as a person, you're trying to prevent yourself from, anybody that might be coughing or sneezing around you. So yes, it's good to wear a face mask to protect yourself, but there's that misconception as to, is this person affected? So you might actually be driving people away from you as opposed to, I'm trying to protect myself.
Oh, yes. Okay. All right then. So I'm guessing the one case we had in Nigeria is really under control.
Yes. So currently the Italian man who came in from, I think,
Italy.
He came in from Italy, through Turkish Air. He's currently under isolation in Lagos. So I'm not sure what the status is right now, but obviously the fact he's under isolation, he's obviously getting treatment. So we just need to watch and see. Hopefully it doesn't lead to, death.
Okay, well, perfect. Damilola, thank you very much for coming on the show.
Thank you.
So guys, you've heard it. People who get here, Nigeria is really prepared, and you really need soap better than hand sanitizer. But if you cannot find a soap, I recommend getting this, So I really hope the whole world gets a hang of this, and this virus really stops in the nearest future. Thank you very much, and stay safe.